Hi everyone, and in this video I'll be discussing fluoroquinolones. Now we are discussing in a sequential manner, and I told you in the beginning we studied drugs affecting cell wall, cell membrane, protein synthesis, and now we are dealing with drugs affecting the DNA. So in that part, what we are going to discuss is fluoroquinolones. Now let us start our journey. Now, what is the mechanism of action of this fluoroquinolones? Mechanism of action. Yes. These fluoroquinolones inhibit an enzyme called DNA gyrase. So they inhibit an enzyme called DNA gyrase, and they will do that job in gram-negative bacteria. So they inhibit the enzyme DNA gyrase in gram-negative bacteria. They inhibit another enzyme, that is DNA topoisomerase 4. DNA topoisomerase 4. This bacteria they inhibit in gram-positive bacteria. Okay, sir. Okay, we understood. In gram-negative bacteria, they inhibit DNA gyrase. Gram-positive, they inhibit DNA topoisomerase 4. But what is the role of DNA gyrase? Now, what is the role of DNA gyrase? Let me tell you. Now, when the DNA has to replicate, you know that the DNA strands are twisted. When you open that twisting, it's like opening up a twisted rope. What happens when you open the rope? The both ends will try to coil. Not only they coil, they will undergo supercoiling. So when they undergo supercoiling, somebody has to remove that supercoil. And that removal of the supercoil is done by DNA gyrase. So what does DNA gyrase do? Let me write here. DNA gyrase, what is the role of it? The role of DNA gyrase is to nick the DNA, and then it will introduce the negative supercoil, and then it will reseals back. So what does it do? First, when there is supercoiling, it will nick that DNAs, that means cut that, and introduce a negative strand for that. Once it is being corrected, that coiling is corrected, again it will reseal it back. That function is done by DNA gyrase so that replication occurs normally. Now, what is the role of DNA topoisomerase 4? DNA topoisomerase 4. Now, the role of this is when the DNA is replicating, it will give rise to the daughter DNA. Yes, so they are the daughter DNA. So that is required for separating the daughter DNA. Separating daughter DNA, we require this enzyme. Now, what happens if I inhibit this DNA gyrase? And what happens if I inhibit DNA topoisomerase? When I inhibit DNA gyrase, the supercoil is not corrected. It will cause DNA damage. And when you damage the DNA, the cell will not survive, it will die. Now, when you inhibit DNA topoisomerase, the daughter DNAs will not get separated. Again, the DNA will be damaged. So, both this process will lead to the DNA damage. And this DNA damage will kill this. So, it will produce the Seidel effect. And remember, these fluoroquinolones are bactericidal drug. So, they are bactericidal drug. Sir, what is the spectrum of action? Obviously, we have written it can affect both gram-positive as well as gram-negative. But remember, humans have DNA topoisomerase 1 and 2. That's why we are not affected. So only the bacteria are going to affect it because they have a separate enzyme, DNA topoisomerase 4. And our enzymes are not affected. That's why our DNAs are safe. So don't worry about that. Now, before introducing this, before we come across this fluoroquinolones, we had something called quinolones. So they are called quinolones. So they are called quinolones, and the first quinolone is called nalidixic acid. So the name is nalidixic acid. Now this had a narrow spectrum. It was used for only few infection. What is that? it was used to treat urinary tract infection. Second, it was used to treat prostatitis. So this was having narrow spectrum. Then we changed the structure of the drug, and then we came with another group of drugs. They are called as fluoroquinolones. They are called as fluoroquinolones. They are called as fluoroquinolones. In fluoroquinolones, we have generations. Generation means they have different activity. Let me write the generation. First generation, then the second generation, then the third generation, and then the fourth generation fluoroquinolones. Okay. What is the first generation fluoroquinolones are? The first generation are norfloxacin, then ciprofloxacin. So you can study the name, they all end with floxacin. In ciprofloxacin, remove that cipro, you get ofloxacin. So these are fluoroquinolones. Now the first generation drugs, they cover mainly the gram negative more than gram positive. Sir, why should I know this? You have a general idea. Gram negative always more chances of causing UTI, and they are having more chance of causing diarrhea and dysentery. So that's the reason the first generation norfloxacin, ciprofloxacin, ofloxacin, they are used in management of UTI and in the management of GIT infections, that is diarrhea as well as dysentery. So you have a general idea like this. Now we came with second generation. Second generation drug is levofloxacin. So levofloxacin has the effect on gram positive equal to gram negative. It has equal coverage of gram positive as well as gram negative organisms. So not only that, it will also cover atypical pneumonia causing bacteria. Atypical bacteria causing pneumonia. So where do you use it? It can be used in the respiratory infections. Respiratory infections. I told you respiratory infections are majorly by gram positive, so it can cover that. So use it in respiratory infection, and most commonly in our country, tuberculosis. So the drug is reserved for tuberculosis nowadays because you know that we are facing the resistant issue. So one of the major drug for TB, and it can also be used in UTI, but we are using it mainly for TB nowadays. We don't give it for simple infections like sore throat or lung infections. Now we are mainly using these drugs for tuberculosis. One of the wonder drug for tuberculosis is levofloxacin. Yes. The third generation fluoroquinolones are not that much used nowadays. For example, gemifloxacin. Then we have the gatifloxacin. Then we have the sparfloxacin. So GGS, Gemi, Gati, sparfloxacin. Now they can also cover gram positive and gram negative, and we are not using them so much common nowadays, so that's why don't worry about them. Now coming to the fourth generation, very very important, we have a drug by the name trovafloxacin. Trovafloxacin is not used. The problem is hepatotoxic. The drug is hepatotoxic, so we are not using. But what we are using is a drug by the name moxifloxacin. The name is moxifloxacin. Most important, what is the spectrum? It is mainly active on gram positive compared to gram negative infection. So the major action of moxifloxacin is on gram positive more than gram negative. That means you can use it to treat which infection? Can you guess? I told you. It is mainly used for gram positive means general infection. You have to think of the lung infection. So it is used in the respiratory infections. And one of the major drug for managing tuberculosis. One of the major drug for tuberculosis nowadays is moxifloxacin and levofloxacin. So that is the differences of generations what we understood from this chart. And that's the reason why norfloxacin is used in UTI. But moxifloxacin is not at all used in UTI. It's not effective in that. So let us understand certain specialities of these drugs. Some of the specialities what can be asked in the exams. Let us understand that. Now coming to the spectrum. Spectrum of activity, they can affect gram positive, gram negative, they can also cover leprosy, and they can also cover TB. This is their spectrum. Now let us start what drugs are effective in tuberculosis. TB, two more major drugs what we use are levofloxacin and moxifloxacin are the major drug for tuberculosis. The least useful for tuberculosis are cipro and ofloxacin. They are least useful, but nowadays what we use is levoflox and moxifloxacin. They can also ask what are respiratory fluoroquinolones. Respiratory fluoroquinolone, FQ means fluoroquinolone, they are the levo, moxi, and one more is gemifloxacin. So these are called as respiratory fluoroquinolone. Let me repeat them: levo, moxi, and gemifloxacin. I told you respiratory infections are commonly by gram positive and they can cover gram positive. Yes. Now another important is the coverage of Pseudomonas. Who can cover Pseudomonas? There are only two important things which can cover Pseudomonas. One is the cipro and one is levo. Not others. Only the cipro and levo can cover this. Cipro and levo can cover this. So these are all the main important things they will ask in the exam. TB, respiratory fluoroquinolone, Pseudomonas, who will cover? And this is very, very important. Which drug is not useful in UTI? Which fluoroquinolone is not useful in UTI? Again, these are all one-liner, and that is called the moxifloxacin. Moxifloxacin is not useful in UTI. Every point which you have written is very, very important. Mark them as MCQs. Very, very important. So these are the things you have to keep in your mind. Spectrum of activity, what you need to understand. I told you the spectrum with this example also, the generation wise. Right. So that's why you take the example of diarrhea dysentery. In your hospital, you would have given Ciplox or Oflox for the patient with diarrhea dysentery. For respiratory infection, we give moxifloxacin or levofloxacin. We don't give moxifloxacin for a patient with diarrhea dysentery usually. Okay, that's a point. Now let us understand the individual drugs. Let us understand the individual drugs in this category. Number one, ciprofloxacin. What is the importance of it? Ciprofloxacin is pharmacologically an enzyme inhibitor. So you know the problem, drug interactions will be more. Okay. Now where to use it? Uses. Now it's a drug of choice for typhoid carriers. Drug of choice for typhoid carriers. So this is one of the important point you need to mark it. It is also used as mass chemoprophylaxis for meningococcal meningitis. Meningococcal meningitis, chemoprophylaxis, we use ciprofloxacin. Two important condition, typhoid carrier and also for mass chemoprophylaxis we can use it. So that is about the major use of ciprofloxacin, and also it is used in a diarrhea called traveler's diarrhea. So these are the major uses. Now moving on to the second drug, if you know ciprofloxacin, remove cipro from that, you get ofloxacin. You get ofloxacin. Where is ofloxacin? Ofloxacin is used in the management of leprosy, TB. So it is also used in diarrhea, UTI and all. I am just mentioning what are the most important uses and most important point for that. Pharmacokinetically, when you give this drug oral, It has approximately 100% viability. So again, a potential question for you. Which drug can have that? Ofloxacin was asked recently. They can increase the risk of seizures. So this fluoroquinolones, not only ofloxacin, fluoroquinolones generally can increase the risk of seizures. So again, mark this point. Very, very important. Fluoroquinolones. Then for the same oflox, you add levo. So now it becomes levofloxacin. So levofloxacin is one of the drug for respiratory infection, as well as it is a major drug for tuberculosis, but pharmacokinetically it has approximately 100% oral viability. So again, this was a NEET PG question for you. Which fluoroquinolone has 100% oral viability? Approximately, I am not telling 100%, approximately. Now there is one more drug which has this approximate 100% oral viability, that is called linezolid. Again, we have ofloxacin and levofloxacin. It was updated in KD Tripathi 8th edition. That question directly came in your exam. The fourth important drug you need to keep in your mind is moxifloxacin. A very, very important drug, moxifloxacin. Now it is used in respiratory infection, correct? It's a respiratory fluoroquinolone. It is used in tuberculosis, very good. It is used in the management of leprosy also. It is also used in intra-abdominal infections. Intra-abdominal infections. Now the question is, will it cover anaerobes? Yes. So one of the fluoroquinolone which covers anaerobe is moxifloxacin. Please write down. This can be a potential MCQ. It covers anaerobes. The name is moxifloxacin. Now, moxifloxacin, there are other special points you need to keep in your mind. There are other special points about moxifloxacin. UTI, can we use it? No, not effective in UTI. In UTI, never use it. Again, a potential question for you. Second, can we use it in respiratory infection? Yes. But the advantage is less chance of seizures with this. Less chances of seizures, more chance of QT prolongation. Now why this is important? Because moxifloxacin is used in tuberculosis. So when the patients are on moxifloxacin, there is a chance of QT prolongation. Since it's a long used drug for TB seizures, so the chance of seizures are less, but there is a chance of QT prolongation, and the drug is very long acting. So this is the other specialty of this drug, moxifloxacin. Never forget this drug. You have to know this in detail. So it can be used in TB, leprosy, and it covers anaerobes, very important, respiratory infections. UTI, never, not at all effective. What is the advantage? Pharmacokinetic advantage, longer acting, but adverse effect, QT prolongation is seen, seizures are less, ofloxacin, seizures are more. So once we know this, the next fifth drug is called gatifloxacin. Gatifloxacin comes under the third generation, but nowadays gatifloxacin is used as eye drops locally, not systemically. So it is used as eye drops for eye infection. And remember norfloxacin. When you think of norfloxacin, major use of that is in UTI. Major use of that drug is UTI. Okay, please consider on moxifloxacin very much. Now once you know this, it is important that we know the adverse effect of these drugs. Adverse effect of fluoroquinolones, very, very important. It has been repeated plenty of times. So let me write the adverse effect now. Let me write the adverse effect. So what is the common adverse effect for all the fluoroquinolone? Common adverse effect, obviously, they can cause allergy and they can produce Stevens-Johnson syndrome. Again, very important question. They can cause Stevens-Johnson syndrome, very, very important. And they can produce the GIT upset, your favorite, the nausea, vomiting, diarrhea. So they can also produce that. Sir, will they cause pseudomembranous colitis? Yes, they can also produce diarrhea, and the reason for diarrhea may be pseudomembranous colitis. PMC stands for pseudomembranous colitis. They are also responsible for that. Apart from that, they can cause tendinitis and tendon rupture. So tendinitis and tendon rupture, which group of patient are affected with this? This is mainly seen with elderly patients. So elderly patients are prone for this problem. Again, a potential question for you. This one, again this one, you have to mark these points. Then after this, they can also cause an important problem, cartilage damage. Now they can cause cartilage damage, again an important potential questions repeatedly asked in exam. You know that cartilage is important for growth, and if it damages, the growth will be hampered. That's why it is contraindicated in pregnancy, lactation, okay, and in children. So when you are using in children, you should substantiate the benefit compared to the risk. So the risk is cartilage damage. If the benefit is more, then you can use it. Otherwise, try to avoid using fluoroquinolone in children. Try to avoid. Right. So these are the common adverse effect. And recently there are certain reports. The fluoroquinolones are known to produce seizures. Now this risk of seizures increase if they already have some CNS problem. The risk is going to be high. And I told you the least risk of seizure is seen with moxifloxacin, but other fluoroquinolone can cause it. That is also asked in your exam. Another risk is peripheral neuropathy. Now peripheral neuropathy, it is not a complication occurs in 1 day, 2 day, 3 day. It will occur only on long-term use. So remember, this is seen on long-term use of the drug. For example, we are using this levofloxacin, moxifloxacin for a very long period. Then there is a risk of peripheral neuropathy. Yes. So we understood the common. What is the specific adverse effect? Some of them produce specific problem. Specific adverse effect of fluoroquinolones. So first we will take up gatifloxacin. Now gatifloxacin was one of the beautiful drug for respiratory infection, but the problem is it produced dysglycemia. You may ask a question, sir, what is dysglycemia? Dysglycemia means patient will suffer with both hyper as well as hypoglycemia. Because of this reason, now it is not given systemically, it is only given as topically as eye drop. The second drug is trofloxacin. Trofloxacin has shown to be hepatotoxic and the usage is not that much. Another drug, sparfloxacin. So spar, it looks like spark. So spark means photo. So it can produce photosensitivity. So spark can produce the photosensitivity. And when there is a spark, your heart will beat faster when you see a spark. So it can cause QT prolongation. QT prolongation. Now tell me, what is the anti-TB drug which is also known to produce that? Moxiflox. So moxifloxacin is also associated with the use of QT prolongation. Let me give a clue for you. The antimicrobials causing QT prolongation, I just give an idea for you. Macrolides can do that. So the antibacterial drugs, macrolides, then fluoroquinolones, the TB drug, bedaquiline, and then the new drug, delamad and pritomanid. So these drugs can cause QT prolongation, very, very commonly asked in the exams. Now there are some pharmacokinetic importance you need to keep in your mind. There is some pharmacokinetic importance which is going to be asked in exam. There are certain fluoroquinolones which undergo bile elimination. Bile elimination. So what are those? You can remember them by the mnemonic PMT, pre-medical test. What is that PMT for? P for pfloxacin, M for moxifloxacin, and T for trovafloxacin. So pfloxacin, moxifloxacin, trovafloxacin, they undergo bioelimination. So what is the question we expect from this? Question number 1, they are safe in renal failure. So the point number 1 is they are safe in renal failure. Yes. Point number 2, they are contraindicated in hepatic disease or hepatic failure. Why it is like this? Because they are eliminated by bile. So in hepatic disease, they should be avoided, contraindicated in hepatic disease. So if they ask you what is all the three options, what is contraindicated? Trova is absolutely contraindicated, then moxi, then pflox. So this is the arrangement. If they have given all the three options, what will be contraindicated? Obviously, trova has to be contraindicated. You know that trovafloxacin adverse hepatotoxicity. Then the second option is moxi and third option is pfloxacin. If they give all the three, they don't give usually. Recently, they had asked a question. They have given fluoroquinolones and they had asked a question which is avoided, and in the option there was pfloxacin. So why? Because they are undergoing bile elimination. And also recently they had asked which is safe in renal failure, and one of the option was moxifloxacin. Again, this is a potential MCQ for you. Moving on to the newer drugs. What are the newer drugs in fluoroquinolones? The name is called delafloxacin. Delafloxacin. So delafloxacin is used to treat AB triple SI. So what do you mean by AB triple SI? Acute bacterial skin and skin structure infection like folliculitis, carbuncle, furuncle, or whatever. Usually that infections are caused by staph aureus, so you can use that delafloxacin. Then we have another drug called ozenoxacin. Ozenoxacin. Ozenoxacin is used to treat impetigo. Impetigo, and it is used topical for treating that impetigo, and that is the new drug ozenoxacin, and that is usually caused by impetigo, streptococcus pyogenes, and we use ozenoxacin to treat impetigo, and it is used topical. These are the newer drugs in fluoroquinolones. Okay, so coming to the summarization of fluoroquinolones, fluoroquinolones mainly affect the DNA. In gram-negative, they inhibit DNA gyrase, and in gram-positive, they inhibit DNA topoisomerase 4. So penetratingly, they inhibit the DNA, and the DNA repair mechanism is hampered, and they are bactericidal drugs. They have very good spectrum. They can cover gram-positive, gram-negative, and they can also cover the tuberculosis and leprosy. Now we classify them as generation, first, second, third, and fourth generation. The first generations are going to cover more gram-negative. As you go on, the coverage is for gram-positive. So Cipro and ofloxacin, they cover gram-negative. That's why we use them in UTI and GAT infections. Levofloxacin cover both. You can use them in UTI, GAT infection, but majorly nowadays we are using it for management of tuberculosis. Third generation, not much used nowadays. Fourth generation, moxifloxacin, very beautiful drug. Moxifloxacin, you can use it in TB, respiratory infection, but one important point, it's not useful in UTI. It causes less seizure, longer acting drug, and it can also cause QT prolongation. Ciprofloxacin is the drug of choice for typhoid carrier, and also it is used for mass chemoprophylaxis in meningococcal infection, that is meningitis. Oflox, Levoflox, they have approximately 100% oral viability. Respiratory fluoroquinolones are the moxifloxacin, levofloxacin, and gemifloxacin. Pseudomonas, there are two drugs which are effective, Cipro and Levo. Then coming to the adverse effect, very commonly asked, they can cause Stevens-Johnson syndrome, allergy, tendinitis and tendon rupture, cartilage damage, and recent reports of seizures, peripheral neuropathy on long-term use, Gatti dysglycemia, and then sparfloxacin, SPARC, that is photosensitivity and QT prolongation. Trovafloxacin is hepatotoxic. There are three drugs which are eliminated in bile: PMT, pflox, moxiflox, and trovafloxacin. safe in renal disease, but they are contraindicated in liver disease. So that is about fluoroquinolones for you. Thank you all.